Hello, my name is Valentina. I'm going to be your student nurse today. Could I have you verify your name and date of birth?
Nikolai Tamula, December 9, 1943.
Alrighty, and can I take a quick look at your wristband? Perfect. Do you have any allergies?
Not that I know of, no.
Okay, and then before we start, I just have a few safety questions we ask everybody. Do you know where you are today?
The Texas A&M Hospital,
Okay, and do you know what year it is?
2023.
Perfect. And do you know why you're here?
I've been having some, dizziness spells recently.
Okay, I'm sorry to hear that. Can you tell me more about the dizziness? When did it start?
Maybe about a month ago.
Month ago, okay. And do you know if it was caused by anything? Like, have you fallen or hit your head or anything like that?
I'm not sure what causes it, but I haven't fallen or had any head
And can you describe what the dizziness episode looks like to you?
Yeah, so I'll just be walking around the house and doing whatever, and all of a sudden I feel unsteady, like I'm falling down.
Okay.
And my vision gets a little blurry.
Okay. And do you know if this has been going on every day? Has it been more like on and off, or?
It's been on and off, but I notice I get dizzy at least once a day.
Okay. Do you know how long the episodes are?
Not very long, maybe just a couple seconds. It normally gets better when I sit down and rest.
Okay, sounds good. So I'll be sure to share all of that with your provider. That way he's aware of all your symptoms. And I just have a few more just health history questions, family history. Is that okay with you?
Yeah, all right.
Okay. Do you have any issues with your blood pressure, either like too high or too low?
Not that I'm aware of.
Okay. And when was the last time you went to the doctor?
It's been a while, maybe 2 to 3 years, but ever since I've been having these dizziness spells, I knew I should come back for a checkup.
Okay, that's good. Do you have any like medical problems we should be aware of?
I was diagnosed with migraines, and I
Okay.
do have type 2 diabetes.
Okay, that's good for us to know. I'll be sure to make a note of that in here. And just to verify, have you been having like any tingling or any shaking of your hands or legs?
My hands shake a little bit, but I think that's just with my age.
Okay, sounds good. So nothing like out of the ordinary.
No.
Okay. Alrighty, let me make a note of that. And do you have any family history of any like neurological problems? So that could be like stroke, vertigo, epilepsy, anything like that.
My dad also had a history of migraines, but my mom died when I was younger from a stroke.
From a stroke, okay. We'll be sure to share that with the provider as well. Do you have like any other symptoms or anything else you want to share with me?
I did want to mention I've been feeling a lot more tired recently than normal.
Okay.
But other than that, that's everything.
Okay, sounds good. So I'm going to share all of this with your provider. Another nurse will come in. They're going to do a neurological exam, especially since you do have that family history of strokes. We're just going to give you a little bit more information on how to prevent that and, you know, what a stroke might look like, just so you're aware, okay?
Okay, sounds good.
Alrighty, is there anything else you might need from me right now?
No, thank
Okay.
you.
Thank you.
Hi, my name is Raymond. I'm going to be your student nurse. I'm going to perform a little neuro exam on you just to ensure that everything's working fine. First, can you please state your name and date of birth for me?
Nikolai Tamula, 1943.
All right, sounds good. I'm just going to check your wristband. All right, Mr. Tamula. So, firstly, I'm going to go ahead and have you grab onto my fingers with both of your hands and squeeze them as hard as you can, okay? A little stronger. Got you? Okay. I'm going to have you stick your arms out right in front of you. Can you please push up as hard as you can? Great. Can you please push down? Great. I'm going to do the same thing with your legs. Please push up. Great. Can you please pull towards you? Awesome. Okay. Next up, I'm going to go ahead and do a little sensation exercise. I'm going to have you close your eyes and just let me know if you feel a sharp or a dull sensation.
Sharp. Dull. Dull. Sharp.
Okay. Next up, I'm going to go ahead and look into your eyes, just to ensure that your pupils are working correctly. Okay. Just look. You can just look straight ahead. Okay. Okay. Very good. Can you please smile with all your teeth for me? Okay. Can you please stick your tongue out? Okay. Great. So now that I've completed that, I'm going to go ahead and bring in a health educator and another nurse. They're going to perform some teaching for you on, I know that you have a family history of stroke, and they're going to teach you some signs and symptoms that you should look out for. Okay?
Hi, I'm Carly Bonds. I'm going to be your student nurse today.
And I'm Will, I'm a health educator.
Can I get you to confirm your name and date of birth?
Nikolai Tamula, December 9, 1943.
Yeah, that checks out with my chart right here. So I know you're complaining about dizziness today, correct?
Yeah.
Yeah, okay, so for dizziness, I just want to make sure that like when you're getting up or moving around that you're really cautious, and then it's okay to take breaks and sit down. And especially when you're rising from bed or like rising from a chair, make sure you take some time to just sit there, relax before you get up, so that way we reduce the fall risk and that sort of thing, okay?
Okay.
We're also going to talk to your provider about hopefully getting some medication for that to lessen that dizziness, because I know it's uncomfortable.
Sounds good.
And it says here you have a family history of strokes. I know that strokes can be a complicated and scary topic. Would you like us to share some different preventative measures that we can do to reduce the risk of having a stroke?
Yeah, I think that would be very helpful.
Okay, great. Well, here's a pamphlet. You can take home and use as a reference, but I'll first go through it with you. So strokes can be triggered by an increase in salt or cholesterol levels. So it's important for you to try to limit those and try to eat a healthy diet. That's just increasing fruits and vegetables, things like that. There's this thing on the pamphlet called the DASH diet. That stands for Dietary Approaches to Stop Hypertension. It's a diet that focuses on eating heart-healthy foods like vegetables and fruits and whole grains. It includes fat-free or low-fat dairy products, fish, poultry, beans, and nuts, and it limits saturated fats and high-carb foods as well.
Okay, yeah, I can start eating healthier.
Awesome. Another preventive activity that would be also beneficial to incorporate would be frequent exercise. Physical activity helps keep your heart strong and help manage weight, decrease your hypertension or your blood pressure, and it also increases the flow of your heart to keep it strong.
I don't really like working out, but I can probably take my dog for a walk every so often.
That's an awesome plan. Also, frequent blood pressure monitoring would be really beneficial because that keeps an eye on your hypertension, so it can detect if that's high, then that's like a sign of stroke, okay? And then also, stopping smoking is a really good idea because that's a risk factor for stroke and just heart problems in general. So it'd be a really good idea if you could limit that as well.
I can try to cut down on the amount of cigarettes I smoke a day, but I don't think I can quit cold turkey. Do y'all have any other options for me?
Yes, I can try to talk to your provider and maybe get him to prescribe you like a nicotine patch. That way we can slowly wean you off of that, and that way you can be tobacco free soon.
Okay, yeah, I think I would like that.
Yeah.
Perfect. We would also like to talk with you about the tool BFAST, which can help identify a stroke sooner so you can get help as soon as possible.
Okay.
So BFAST is an acronym that describes the different signs that someone is having whenever they're having a stroke. It stands for B is loss of balance or dizziness. E is eye troubles such as blurred vision. F is facial drooping. A is arm weakness in one side. S is slurred speech, and T is time. So how quickly you can report this and call 911. If you notice yourself or anyone else showing these signs, it's important to get help right away because time is crucial.
Okay, that makes sense. Thank you.
So what are the different types of preventative methods that you plan to implement?
I'll plan on eating better. I really like fruits and veggies, so I can probably just eat those more. And then I can go on more walks. I can walk my dog every so often and try to limit the amount I smoke every day. And then I can, every day, I'll measure my blood pressure and make sure it's not high.
Yeah, that's a really, really good plan. What are the signs that you're going to be looking for? Like if you see somebody who's having a stroke, or like if you feel it yourself, what would you look for?
Y'all taught me that BFAST acronym. B with balance issues, E for like eye issues, maybe like blurred vision. F for my face may feel weird, or I'll see facial drooping. And then A for arm weakness or some kind of one-sided weakness. And then slurred speech or like difficulty speaking. And then T is time. And I'll try to call 911 as soon as I notice those signs.
Yeah, that's
Yeah.
perfect.
Great. Well, before we end your visit, do you have any questions for us?
No, I think you went over everything. Thank you.
All right, well, well, we're gonna make sure we talk to your doctor to get you hopefully some medication for that dizziness, and we'll come see you soon.
All right, thank y'all.
Thank you.